Hello and welcome back. It's been a while since I've recorded a video of any sort. I am considering making some plans to returning to recording and possibly doing streaming again. Um, anyway, I wanted to make a quick video over about some issues I've been having with the Iowa Department of Health and Human Services and specifically Medicaid. Um, Not a lot of my I'm not sure if any of my viewers know that I am technically disabled and receive SSDI and therefore Medicaid and Medicare um, in terms of my insurance. But I wanted to kind of make a video and go over kind of some of the struggles I've been having because for the last couple years I've been quite literally fighting with the Iowa Department of Health and Human Services to make sure that my benefits are properly being applied and that I'm receiving the Medicaid that I'm supposed to be getting as an individual that's eligible for SSI. Um, and, this could be a bit of a rant, obviously, it's extremely anxiety inducing what is going on. And obviously, when we look at what, Doge and what Elon Musk and what Trump are doing, I think it's safe to say that these issues probably aren't going to get any better, at least for the immediate future, especially with all the job cuts and stuff. I will be the first to probably say that I don't think that on paper what they're doing is a bad thing. It's really going to boil down to how they're implementing it that's not really helpful. And I think, unfortunately, they're targeting a lot of the wrong employees with these terminations. And I think there's a lot more employees that are far more incompetent and incapable of doing their jobs effectively that they probably need to be focusing on in terms of these terminations, and they're just not. So, unfortunately, for a while now, we've had a lot of incompetent employees working for various agencies, including, Health and Human Services, Social Security, you name it. And so it's very difficult, if not impossible, to get a lot of things done. And it's only getting worse. I mean, currently, right now, you can't even call the Social Security Administration at their main number without them notifying you that there's a 2-hour wait. And if you're lucky, they can get you put into a callback queue. And even though it's a 2-hour wait, that callback, from my experience, has turned into like 4 hours for whatever reason. And I don't know why that is. I couldn't even begin to tell you what the, issue with that is. But even calling the local number is not much better. Most of the time, they either route you to, even though it's literally the number for the, in my case, Des Moines Social Security Administration office, they're either routing you to other field offices in the state or just telling you to call back because they're too busy to answer your call. So anyway, the issue I've had with Medicaid specifically is all of my documentation for Social Security clearly shows that I am still eligible for SSI. The only thing that's changed in terms of my SSI status is that due to increases to my SSDI, my SSI payments have stopped. So there's a difference between your payments stopping and you being ineligible. You can have your payments for SSI stop and still remain eligible for SSI. And that's what's happened in my case. Ironically, even if an argument could be made that I'm no longer eligible for SSI, which again contradicts the, proof of benefits or benefits verification letter, there are other categories that I would qualify for Medicaid under. But starting about 2 years ago, I had been working. I had had a job, and they had actually transferred me to the they converted my Medicaid to what's called Medicaid for employed persons with disabilities out here. Now, why they did that is beyond me, because there are technically rules when it comes to SSI recipients that actually prohibit that. So again, I don't know why Iowa HHS or Health and Human Services is making the decisions that they're making, but a lot of them are just far from accurate and complete. And so I think we need to definitely look at those things, because I recently had to do my redetermination, my annual redetermination for my Medicaid, and I received a letter in the mail that actually said that, if I can find it, I have it actually right here. And basically they redetermined my Medicaid, and by their assessment, if I can find it, I all of a sudden actually don't know where that is, but I found it. So in this notice of action that I received from Iowa Health and Human Services, it says that I've been approved for limited Medicaid services beginning May 1st, 2025. Medicaid will only pay the Part B premium. Now, it also cites several administrative codes. They're obviously very confusing, many of which don't apply. One of the administrative codes that it cites pertains to people in medical facilities, which doesn't apply to me, obviously. One of them applies to people working, doesn't apply to me. Some of them apply to income limits. And the last one they cite obviously refers to SSI eligibility. Anyway, because of these issues that I've been having for the last couple years, I actually reached out to their executive assistant. Her name's LaTanya with Health and Human Services, and she got me in contact with someone named Brian Meyer, who over the course of the last year has kind of been a very useful connection in terms of getting my Medicaid fixed anytime this happens. Because what's happening is, unfortunately, every time they do a redetermination or their system does a batch run, it's kicking my Medicaid eligibility into the limited eligibility status, which it should not be. I have spoken to Brian Meyer, and he's actually told me that at least as of last year, he was able to see that it clearly said that I was eligible for SSI. Even as of Monday, I called and a worker did some digging, and she was able to see it says I'm eligible for SSI. In fact, she did some digging, and she was pretty sure that she actually identified the issue, and also a resolution, and passed that on to her supervisor. Obviously, she didn't want to make any changes or overstep what the managers were doing already, since management was already involved. And unfortunately, I reached out to Brian this time around, because he was my point of contact all last year. And last year, I should clarify, he actually fixed my Medicaid on no less than 2 occasions. Because obviously, he can see that I'm eligible for SSI. And so, once when I was under my annual redetermination, which is this time of the year, and then later in the year, their system did a batch run and he fixed it then. Unfortunately, I reached out to him this year, and he told me that back in February, they changed job duties. So he no longer handles Medicaid, and that is handled by somebody named Evie Neri. I'm pretty sure that's how she pronounces her name. But rather than Evie Neri doing her own investigation and fixing it, she decided she was going to have a supervisor handle it. And I'm pretty sure that the supervisor that handled it is a supervisor that's had a history of overlooking my my SSI eligibility, as I'm pretty sure I've spoken to her in the past and she's overlooked it. Specifically back in 2023 when I was trying to get things fixed after they put me on the MEPD, which, you know, as I found out more recently, should never have happened to begin with. So anyway, Evie passed it on to this lady named Tara, and this is the email I got back from her today. It says, "Hi, Xavier. Evie asked me to contact you regarding your Medicare concerns. I have analyzed your Medicaid case by investigating your SSI and SS payment history and the document that you have provided to the department to see if you would qualify for Medicaid. You're currently considered disabled according to the Social Security Administration and receiving a Social Security disability payment of $1,342 per month. I found that you do not qualify for full Medicaid coverage and that the Medicare Savings Program you're currently receiving is the correct coverage. There are several full Medicaid coverage groups available under the umbrella of people who are ineligible for SSI. However, you fail to meet the criteria for eligibility under any of them. I found that you stopped drawing Social Security off your parents' claim in January of 2022. Which ended your Medicaid entitlement under the coverage group ineligible for SSI due to Social Security benefits paid from a parent's account. You've received increases in your Social Security payment due to reasons other than COLA in July 2022 and October of 2023. This makes you ineligible for Medicaid under the coverage group ineligible for SSI due to Social Security, COLA's 503 medical only. You are not working, so you're not eligible under the coverage ineligible for SSI due to earnings too high for an SSI cash payment or 1619B group. Your SSI was terminated in April 2024, so you're not eligible for Medicaid as an SSI recipient for people eligible for SSI benefits but not receiving them. These findings were sent to a Medicaid program manager who agreed with my conclusion that you're not eligible for Medicaid under any of the SSI or people ineligible for SSI or SSA coverage groups. I also called the Des Moines Social Security Administration yesterday to verify that HHS was using the correct information, which they confirmed. SSA verified that your SSI record was terminated April 2024. They also confirmed that you drew SS off of your father's claim from April 2013 to January 22. You stopped drawing off your father in January 2022 because your own claim exceeded that which you would get from your father's claim. They stated that the increases to SS for reasons other than COLA had to do with your earned income. It was explained that twice a year SSA runs annual earning batch, which uses earnings from the previous year to recalculate the amount of monthly SS payment that is due to a recipient. Your claim was picked up in one of those batches, causing your SS payment to increase for a reason other than COLAs. In conclusion, upon consulting with HHS Medicaid Program Manager and the Social Security Administration, I have determined that you are currently receiving the only coverage that you're eligible for, which is the Medicare Savings Plan. Tara Schlichting, or however she pronounces it, Eligibility Determination Supervisor. Anyway, the first glaring issue I want to point out here is the fact that she claims that she called the Des Moines Social Security Administration yesterday. The issue with this is that if she called the Social Security Administration, there's no guarantee she actually spoke to somebody at the Des Moines office, and because obviously if they're busy, they route the calls to other field offices in the state. Also, Social Security employees are known to be inaccurate in their statements. Like, Social Security actually has policies that they've implemented to protect them because their representatives are known to provide misinformation. And so even if this phone call was recorded, the statements can't even legitimately be used for any purpose, really. And what's even more alarming is that Social Security has between Social Security and DHS, they have what's called they have a data exchange. And so with that, the data exchange is basically the information that Social Security puts in their system and shares with other state and federal agencies for the purposes of benefits. And under that, there are clearly policies and procedures that would most likely require them to put in a request for any verification of this information, either in writing or electronically. And obviously this is a security and privacy issue, because if she actually called the Social Security Administration and they provided her any information, then we have a problem. We have a privacy problem there, because that means anyone can call the Social Security Administration and tell them that they work for Health and Human Services and pretty much get whatever information they want from the Social Security Administration. And so obviously, we've got problems on their end. I do plan on actually making a complaint with the Social Security Office of the Inspector General about that. I just had to actually file a complaint last week on one of their supervisors who was violating their policy regarding, recording of interviews, which allows for individuals and their representatives to record the phone calls, as well as interactions with the Social Security representatives, at least in terms of audio recording. And they're actually specifically told that they're not supposed to encourage these, but it's allowed. Not only did he try to say that I wasn't allowed to record the call, but he tried to encourage me and, invite me to come into the Social Security Administration recording, and that if I did, he would contact the Federal Protective Service, FPS. Both of those actually violate Social Security's policy on the matter. So we know that the local office here is violating policies, probably left and right. And so it wouldn't surprise me if they violated their privacy policies and disclosed information over the phone to this employee, even though it's clearly not 100% accurate what was provided to her. So that being said, I think we need to turn our attention to specifically my actual benefits verification letter, which obviously she's claiming is not valid and completely ignoring. Obviously, I'm not going to show the whole thing because it's got sensitive information, but I do feel comfortable enough sharing this little section. This is on page 2 of my benefits verification letter, but as it clearly states, information regarding supplemental security income, which is SSI. Beginning April 2024, the current supplemental security income payment is $0. This payment amount may change from month to month if income or living situation changes. Supplemental security income payments are paid the month they are due. For example, payments for March are paid in March. Payments were stopped beginning April 2024. We found that you're disabled under our rules on March 23rd of 2013. You are entitled, which again implies eligible, to monthly payments as a disabled individual. So basically what this is saying is that I am, in fact, despite the fact that they've stopped my SSI payments, I am in fact still eligible for SSI. And she clearly addresses this scenario in her email, where she obviously indicates that, where she indicates that, obviously, there are circumstances where a person where payments would stop, and a person would remain eligible. Um, so, right here, she's like, your SSI was terminated in April 2024. So you're not eligible for Medicaid as an SSI recipient or people eligible for SSI benefits but not receiving them. And so again, my benefits verification letter clearly contradicts that, as it clearly shows that yes, the payments were stopped, but I am still eligible under their rules. And if you also read right here, the reason it says the payment amount may change from month to month if the income or living situation changes is because, as I'll get into when I pull up the POMS, or the actual policies for the Social Security Administration and the rules that, apply here, there is a threshold, so a number that if your SSDI amount goes above, it will result in your payments for SSI becoming $0, or they'll stop paying them out. And so if that number actually goes above your current SSDI amount, and they will resume paying, in my case, they will resume paying out my SSI because I'm still eligible. So, and likewise, if something were to happen to my SSDI, and I were to lose it, become ineligible for it, or it would decrease for whatever reason, they would also resume my SSI payments. And so for her to sit here and say that it was terminated, that's not correct. The payments were stopped, but my SSI record was not terminated. There's a difference between them stopping the payments and them terminating the record entirely. And as we can see from my benefits verification letter, which is my proof of benefits and proof of income, the payments were stopped, but I'm still eligible for them. And so, contrary to what she says here, I should be eligible for Medicaid as an SSI recipient, eligible for SSI benefits, but not receiving them. Because, again, it's not terminated, they're just stopped. I'm still eligible for them, and they will resume paying out if something happens where either the threshold is increased above my current SSDI amount, or my SSDI goes below that amount. So obviously what this supervisor is saying is just not accurate. She's in complete denial of the facts. Obviously the document she's referring to is my benefits verification letter. Obviously she's trying to disregard that. So again, let's get into the rules real quick, because I think that's important here. So the rules for this are specifically under SI 01715.015, Special Groups for Former SSI Recipients. And this is what she's referring to by all these rules over here. But basically, under Section 1619, a person, it says, individuals who utilizing the Section 1619B work incentive provision do not receive SSI payments. In order to continue Medicaid eligibility, 1619B participants are deemed by law to be receiving an SSI payment for Medicaid purposes. Congress also added a special rule for Section 1619A and B participants in 209B states. If an individual received Medicaid coverage for the month before the most recent period of participation in Section 1619B, A or B, the state must continue coverage so long as the individual continues to be eligible under 1619. This applies even when the 209B state has a more restrictive definition of disability than that of the SSI program. SSI notifies states about members of this group through the State Data Exchange. Note the NMI does not receive the SDX. So Obviously, this provides some examples, but basically, Social Security is supposed to notify the state agency that the person qualifies under 1619. And basically, what this is a section that says, okay, your income has increased due to you working. You are currently working, and so because you're working and your income has increased, we're no longer going to pay you SSI benefits, but you're going to remain eligible for the purpose of Medicaid. Obviously, as she says, I'm not working currently. But it's this very rule that they actually violated back in 2023 when I started having these problems, when they decided they were going to move me to their Medicaid for Employed Persons with Disabilities program. Because under this rule, there should have just been no changes to my Medicaid at all when I was working. So, again, there's just simply a lot of issues with how they're handling things here in Iowa. But let's get into the one that definitely applies to my case, that she's also saying does not. Or rather, I should say would apply in my case if I was no longer eligible for SSI, as she claims. So, under Section 2 of this, it says Title II COLA, or also known as the Pickle Amendment. Effective July 1st, 1977, Medicaid eligibility was protected for SSI who lost SSI or SSP eligibility because of Title II cost of living adjustments, or COLAs. The COLA, in case you're wondering, is the annual increase that they send you notice of every year, and goes into effect January 1st of each year. And so it's a percentage that they increase based on what the cost of living is in the country, the average cost of living for the entire country. So anyway, it says under Section 503 of Public Law, blah, 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 the Pickle Amendment, Title II beneficiaries who continue to receive SSI/SSP payments or would continue to be eligible for benefits under 1619B, but for the Title II COLAs continue to be considered SSI recipients for Medicaid purposes. If an individual's other income would not have precluded continuing SSI payments. So again, here we're talking about other income, which would be that work income that they're referring to, that resulted in an increase to my benefits. So if an individual's other income would not have precluded continuing SSI payments or deemed payments under Section 1619 without the Title II COLAs, the state must continue to consider the individual to be an SSI recipient for Medicaid purposes. When a state agency computes Pickle eligibility, it uses the current SSI federal benefit rate, FBR. That's that threshold I mentioned earlier where it's the maximum amount you can receive on other income before you just no longer get your SSI. Plus any SSP, and compares it to the beneficiary's other countable income plus the Title II benefit frozen at the amount when the SSI SSP payment eligibility was lost. So basically what that says is that when I would have lost eligibility as a result of this, obviously we can see based on my benefits verification letter, my proof of income / benefits, I'm still eligible for SSI. So this technically doesn't even apply. But it would apply if I wasn't eligible for SSI. But basically what it says is that, the benefit is frozen. So basically whatever my SSDI was at the time that my income rose above the limit, that is what they have to freeze it at. So if we say it went into effect, if we say that we use the April 2024, then my income would have been at 1309. And so they have to freeze it at that, But But also, if you continue reading, it says, if the FBR keeps going up as it has, the FBR can eventually overtake an individual's frozen Title II plus other countable income level. Basically, what that means is, as I was saying before, that threshold, has continued to rise. And so at some point, it may very well overtake my current SSDI payments. And again, they would start paying out my SSI again. So they would start paying me SSI benefits again if that went above my current SSDI. As you can see here in Section A, Other Income, it clearly accounts for the very scenario that they're trying to say disqualifies me under this rule. If an SSI recipient had Title II and other income, which would include work income, which resulted in the loss of SSI, increases in the SSI FBR, or a decrease in the other income, they can still be eligible for Medicaid continuation under the Pickle Amendment. So, as you can see, under this amendment here, even if I was not eligible for SSI, this Pickle Amendment here would actually protect my Medicaid eligibility. And so, again, as indicated over here, we have a supervisor of all people who is just flat out denying the fact that clearly we have documentation from Social Security that clearly shows that I'm still eligible for my SSI, for one. And two, even if I wasn't eligible, the Pickle Amendment protects my Medicaid as a result of my SSDI increasing as a result of COLA and other income, including work income. So, I hate to say it, but there's a reason why Iowa is, people may or may not know this, but, my dad, he's an Iowa native. He grew up saying that Iowa's an acronym for idiots out walking around. This is actually a common joke / meme that goes around here. And, I think this is a perfect example of the fact that we've got people who are working within our government that are completely incompetent. And, when we actually take a look at what Doge and Trump, Elon, what they're doing, these are the people that they need to be firing under all of these, these mass firings. Because it's these people who are completely incompetent, and even when this information is presented to them right in front of them, they ignore it. They disregard it. They don't even look at it. I mean, even last year, Brian Meyer, the manager that I'd been in contact with last year, basically said it was obvious that whoever was doing my reviews and whoever was looking at my account was clearly not doing a good enough job to look well enough to see that it clearly said that I was SSI eligible. And so, if we go on that, it's obvious that I'm SSI eligible, And again, just because the payments have stopped, that doesn't make me ineligible for SSI. It just means I'm not currently receiving any money through SSI. It hasn't been terminated. This benefits verification letter is actually dated today. It's dated Thursday, April 2nd. I'm not going to scroll up to the top because, again, that's where all the personal information is. But this is dated April 2nd. So, obviously Social Security has it in their system. And by extension, the State Data Exchange should show this also, that I am in fact eligible for SSI benefits. I mean, anybody with half a brain cell can look and see it says, you're disabled under our rules, March 23rd, 2013, and this applies to supplemental security income payments. You are entitled, which automatically implies eligible. The amount may change. Obviously, it's not terminated. It's just in a suspended or a stopped status. And so again, she clearly, points this out in her own email. where she says your SSI was terminated in April 2024. So you're not eligible as an SSI recipient or people eligible for SSI benefits but not receiving them. Again, my SSI is not terminated. The payments are stopped. And so I am an SSI recipient or a person eligible for SSI but not receiving it. So, take it for what you will, but I think we can safely say that this Tara person is the whole reason, is part of the reason why the meme about Iowa being an acronym for idiots out walking around is even a thing. It's people like her that give everybody else a bad name, and it's people like her that Elon Musk and Donald Trump and Doge need to be looking at firing, because you can clearly look at everything I've just shown, and you can clearly see that, one, I am technically still eligible for SSI despite payments being stopped. It doesn't say that the SSI was terminated. It just says that the payments were stopped. Everything else in this little section of my benefits verification letter clearly implies that I am still eligible for SSI. And if something happens with my SSDI, or that federal, that threshold were to increase above my current amount, which, as she indicated, is $1,342 a month, they would resume paying out SSI to me. And so, again, nothing here says that my benefits were terminated. It clearly says that I'm disabled under their rules for SSI, and I am entitled to monthly payments as a disabled individual. Entitled implying eligible. And so, again, just because they stopped does not mean I'm not eligible. And even she acknowledged that by citing that exact scenario, despite the fact that she is adamantly insistent that my benefits were terminated. So I don't know what the issue is there. I don't know if what's happening is these people are just so incompetent and stupid that they're looking at my record and they're like, oh, he's getting $1,342 a month in SSDI, and he's not getting any payments from SSI, so he's not eligible for SSI. But obviously we can see that's not the case. I am most definitely eligible for SSI, and so I qualify for full Medicaid under those rules. And again, even if the SSI record had been terminated, as she claims, the Title II COLA or Pickle Amendment actually accounts for the very scenario that she's outlined in her email that Social Security claims applies, which is obviously that they stated that the increases to SS or Social Security for reasons other than COLA had to do with your earned income. And again, and other income which resulted in the loss of SSI can result in eligibility for Medicaid continuation under the Pickle Amendment. So it's all right there. And it's just a matter of, it's just a question of how or why these people are so incompetent and stupid. And again, like I said, why, it begs the question as to why Doge, Elon Musk, and Trump aren't targeting these people. Because there's absolutely no reason why she should be denying the validity of a Social Security document that has historically been used across the nation as proof of benefits. And again, like I said, why is she even calling the Social Security Administration and not going through the proper channels to have this put into writing, or have this request for verification put into writing or submitted electronically through the state data exchange? Obviously, there are procedures that are there to help protect privacy. And again, even if you go by this, Where's the documented evidence that any of this is accurate or true? Are we supposed to just take her word that she allegedly talked to a Social Security employee? And again, when Social Security employees are known to be inaccurate, how do we know that that information was even correct, or she even understood what they were talking about? I mean, obviously, like I said, if you look at the facts and you look at the evidence, I am definitely eligible for SSI, despite my payments being stopped. My SSI record has not been terminated. It is still very much there. And it's just stopped. I mean, until either that threshold overtakes my current SSDI income, or my SSDI income gets reduced below that. So again, we can look at the evidence, we can look at the actual rules and regulations and laws surrounding this, but I mean, these people working for Iowa HHS are just completely incompetent and don't know what the hell they're even talking about or doing. And the evidence shows that. So, obviously I've once again escalated this back to LaTanya, the executive assistant. And I've also started, I sent a barrage of emails just because of how angry I was about this today. But I've also included Brian in those emails. I've told this lady off quite a bit tonight about how incorrect her record is and the fact that it's inappropriate, because by extension here, she's saying that a manager above her should not have made the changes that he made last year to ensure that I was getting my proper benefits. And like I said, that same manager was able to see my SSI eligibility in their system, which has not changed. So, again, where she's getting her information is beyond me. So I'm going to leave it there. Leave your comments, leave your, thoughts in the comments and stuff. But, I mean, obviously this is extremely frustrating. I mean, but honestly, I think, at some point we're going to have to start reaching out to legislation and proper people to, make sure that meaningful change is happening. Like I said, this person here needs to be fired, because what she's saying here, and by extension, whoever this Medicaid program manager she worked with, whether it was Evie Neri or what, or who, they need to be fired also. And so, like, if anybody else is having problems like this with their Medicaid and their Social Security and their SSI, I would strongly advise that people start reaching out to places like Doge, if they can find a way to get a hold of Elon Musk or Donald Trump. But I think, and legislators or whoever, but we need to have a call to action to where we're actually focusing, where we're pushing to ensure that the focus is terminating the right employees. Terminating employees like this person and the Medicaid program manager that made this assessment. Pushes to have the employees at Social Security Administration that are violating policies, that are freely giving information away to people just because they claim to work for HHS over the phone. People who at Social Security that don't want to follow their policies, that want to sit there and violate the policies and tell people they can't record phone calls, even though the Social Security Administration's policy is quite the opposite. And so again, we just need to have a call to action here, and we need to get, the proper individuals to direct their attention where their attention should be directed. And, like I said, what on paper, what Doge and what Trumper's doing sounds good, but clearly they're not putting their attention towards the people that need to have that attention on them. Again, this is a supervisor. Yet she thought a phone call was perfectly acceptable. A phone call where she got nothing in writing, nothing, that actually proved what she was even trying to say. And again, someone who clearly had access to this document over here, as she references it here, and completely disregarded what the Social Security Administration says in writing, and instead chose to listen to somebody over the phone who clearly didn't know what they were talking about either. So, yeah, I mean, leave your comments, if anybody's having the same problem, feel free to let me know. But, I think at some point we're going to have a call to action where we're going to have to start getting a hold of legislators. We're going to have to start getting a hold of Doge. We're going to have to start getting a hold of the White House, and we're going to have to start trying to push them to do the right thing and get people and focus on people like this Tara Schlichting, or however you pronounce her last name, and push for their termination, because like I said, I mean, this is just not okay what these people are doing. And so, like I said, this person here and this person here and this person that whoever she spoke to need to be terminated, because obviously they don't know what they're talking about. They're not actually looking at the facts or the documentation, and instead, even if they are, they're flat out denying it and denying the facts and disregarding them in favor of whatever they're trying to do, in favor of their own agenda. And oftentimes the fact that, I hate to say it, Iowans in particular, from my, and I get this is human nature, but from my experience living in Iowa, I'm originally from Colorado, in case you guys don't know, but from my experience living in Iowa, Iowans not only have a propensity to be pretty stupid and dumb, but they also have a really bad habit of not wanting to take any accountability or even acknowledge when they're wrong. And so the go-to is, they're just never going to solve the problem because they don't want to acknowledge that they're wrong. And so my concern is, unless LaTanya and Brian and other people within HHS get involved and get this fixed like Brian was doing all last year, this is just going to be a reoccurring thing. And like I said, we already have one worker who's gone in, and she seems to have identified the problem as well as the solution, and passed that on to her supervisor, which is not Tara. But she wanted to wait until they got clearance from her supervisor and Evie, the manager, before she implemented her fix. Now, obviously, that's probably not going to happen at this point, without some pretty big pushing, but this is just ridiculous. You know what I'm saying? Especially when all of the evidence demonstrates otherwise and shows that this is just not correct. Not only am I eligible for SSI despite the payments being stopped, but even if I wasn't, as I showed everybody, I'm eligible under their Pickle Amendment. So, again, I'm going to leave you all with that. That was just a bit of a rant. I felt like, maybe I should make a video, because I'm sure I'm not the only person that's having these problems, whether it's here in Iowa or elsewhere. And I really should probably clarify that when I talk vulgar about Iowans, I am mainly referring to our government officials and government employees, such as this person here. I mean, I think most people here in Iowa absolutely despise our governor, And so, I wouldn't say all Iowans fall into this category, but I would say that definitely those that we have appointed to our government and our government agencies have hired, a large portion of them do fall into those categories. So again, just want to clarify that before I let y'all go, but, especially if somebody here in Iowa is listening to this, because, I've met some good people here. But from my experience, we've got a lot of, people that, in business and, in businesses out here, and especially within our government agencies, that they just let the power go to their head and they just don't care. And so we've got people that are doing the very things this Tara person is doing, and they need to be held accountable. So anyway, I'm going to leave you with that. Like I said, drop a comment. Feel free to let me know if you're having the same problems. And like I said, I think at some point, it's going to get to a point where we're just going to have to start pushing legislation. We're going to have to probably find a way to reach out to Doge and Elon and Trump and be like, hey, these are the people you need to investigate. These are the people that you need to look at firing. And so I'm going to leave it at that, But once again, thank you for watching. I'm actually going to have another video that I'm going to be making here shortly because I'm going to go over some stuff with the channel in general. But I wanted to get this out because I think it's extremely anxiety-inducing to me, and I'm sure a lot of other people feel the same way when they get notices of action from their state DHS or Social Security or whoever, and they're being told that they're losing benefits that they actually qualify for, and even when it gets escalated through supervisors and managers, they're still denying the facts and refusing to provide you with the proper benefits. Anyway, you guys have a good rest of your day, night, wherever you are, and like I said, I'm going to get another video that's going to be more general about the channel and changes and stuff, because obviously with these issues, and that's one other thing. Like, what's weird is that, like, as I mentioned, the Medicaid for Employed Persons with Disability program that they put me on a couple years ago, the ironic thing is that I could probably solve all these problems right now and guarantee myself full coverage simply by notifying them that I am working. And because I could simply tell them that I'm a content creator, and because that's a valid job, even if my channel's not monetized, technically it's a job, and so they would, by their own policies and rules, put me under the Medicaid for Employed Persons with Disabilities based on how they're handling things, and I would get full Medicaid benefits as a disabled, as an employed disabled person. And because my channel's not monetized, I would still continue receiving the same amount here, and because that's below the amount that's required to charge a premium, I wouldn't even get a premium on my, I wouldn't even have a premium on my Medicare. Now, of course, that could change if YouTube monetized me, but who knows how long that would take. But, that just shows how stupid and dumb this whole thing is here and how they're handling everything out here. Because, like I said, it is that simple. It is so simple that all I would have to do is notify them that I'm a content creator. And voila, I get full Medicaid benefits as a disabled worker, as an employee, as a employed disabled person. So, again, it just shows how stupid and ridiculous all this stuff is, and why they really need to figure this out, because, it just doesn't make sense. So, anyway, again, drop a comment. Feel free to let me know if you're experiencing similar problems with Medicaid or Social Security or, SSI or whatever. And again, you can always reach out to legislation. You can always reach out to, I mean, I'm sure there's a way to reach out to Doge or Elon or Trump. I mean, even if it is over X. But, you know, there are phone numbers for the White House, you know, there, and so and there is, I believe, a contact form on the Doge website. So there is definitely ways to obviously notify these people. And even then, you know, like I said, you've got your legislators, you know, you've got legal aid. Most legal aid services, I'm sure, would help with something like this also if they have the funding. You know, of course, funding's a big issue. But also, you know, there are other channels you can go through. I mean, you can file a complaint for Medicaid fraud over this kind of stuff with the CMS or more specifically Federal Health and Human Services, because a lot of people may not know this, but employee misconduct, issues like this, you know, all of that falls under the fraud category. And so even when I filed the complaints against the local Social Security office last week, that is taken as a fraud complaint because fraud covers misuse, abuse, and all that other stuff when dealing with these kinds of issues. And so, you know, not only is there a way to report these with your state health and human services, and they've got channels to report the fraud, because that's what this is, you know, and they're incorrectly denying you benefits and breaking these rules and violating all these laws. That does fall under fraud for the purpose of these complaints. And so you can file a fraud complaint with your state health and human services, or even the federal health and human services, over these kinds of issues. And like I said, like the issues of Social Security, you can file the complaint with the Office of the Inspector General for the Social Security Administration. So there are channels to get these things addressed. It's just they take a long time, and, you know, again, it's extremely anxiety inducing. And I can tell you from firsthand, you probably hear it, you know, in my voice, you know, and all that other stuff. But yeah, drop a comment, you know, let me know what you guys think. You know, feel free to, you know, share your own experiences. But I don't think it's going to get much better anytime soon. I really don't. You know, I mean, you know, I think we're going to have to hit rock bottom before it starts to get better. And I say that for better or for worse. So staying in there, guys. You know, I mean, like I said, I'm doing my best to do that. But yeah, so anyway, appreciate you guys, and I look forward to seeing you in the next video.